real life superheroes and take that opportunity to get vaccinated. 2 years has gone both very quickly and very slowly. However, as we look back, it's clear to see how far we have come. We've shifted from complete pandemic shutdowns and staying at home to the gradual reopening and closure at times of businesses and activities. And as we sit here, over 90% of those who are eligible in our communities have received at least 2 doses of the COVID vaccine. Our continuous collective fight against this virus has not been easy, and we've all had different experiences throughout the pandemic. As we continue to adapt to the restrictions and as we continue to adapt to our new reality, I hope that we can continue to treat each other with kindness, to treat each other with dignity, and to remember that we are truly still all in this together. Thanks to each and every single one of you for continuing to do your part. Thanks to your family, to your friends. We could not have reached this point of the pandemic without our collective care and efforts for one another. And we at the Health Unit are grateful for the ongoing support that we receive from you. With that, I'm going to pass things back to Warden Warwick. Thanks for being with us this afternoon.
Well, first of all, Josh stole my speech, and then the rural internet gods kicked me off. So I'm on my 3rd strike now, so let's hope this goes well. First of all, I would like to congratulate Dr. Summers on taking the position of Medical Officer of Health, as well as my congratulations to Emily Williams in her position of CEO of the Middlesex-London Health Unit. They have done excellent work throughout their interim positions, and I look forward to seeing what they're able to achieve in the future. We all know that the announcements regarding the reduction or elimination of COVID restrictions are coming out daily. And I think we all know that the lack of testing isn't showing the true numbers of people that are currently infected. However, I believe that we're all starting to understand how to manage under these conditions. But this still means that the disease is a real concern. So I ask you to behave responsibly, and when March 21st comes, that you respect the personal choice of masking or unmasking and continue to follow the recommendations of our health unit. Everyone has their own reasons for continuing to mask, and we need to honor those reasons. We also must be vigilant for the dangers of influenza, which, although hasn't been much of a concern lately, can still be a challenge for our vulnerable population. It's hard not to be optimistic when we have the signs of spring all around us, and we are in a much better situation than we were a year ago at this time. Don't forget to change your clocks this weekend. And I must confess, this is my least favorite time change. And maybe when the pandemic is truly over, we can all unite and end daylight savings time. Until then, enjoy the changing of the seasons. And again, thank you for this time today.
Thank you, Warden Warwick, Acting Mayor Morgan, and Dr. Summers. I had forgotten about that is the weekend to change our clocks. So thank you for that reminder. All right, we do have several questions in the queue, so we're going to get to those right away. I'm going to start, Dr. Summers, with a question for you. It's from James Sims at the London Free Press. Dr. Summers, you've said before that you expect that cases will spike once mask mandates are lifted. Do you have any sense of how much they might spike?
Yeah, great question, Jane. Thank you for it. When we look at our epidemiologic curve as we speak, we obviously saw a tremendous decline in cases through the Omicron wave, but what we are seeing now is a gradual plateauing of those cases, if not a slight uptake of cases most recently. That is, of course, as a result of a decrease in the public health protections of physical distancing, capacity limits, proof of vaccination, etc. That will continue to happen as mask mandates are lifted, as it is another one of the layered protections that will be rolled back. In terms of how much cases will go up, I don't know. The reason that we don't know is because it is not clear how many people remain vulnerable to COVID-19 in our community. We have still a number of people who have been boosted and a number of people who were exposed to the Omicron variant during this last wave. Most people who've been boosted or who have been exposed are unlikely to end up severely ill from COVID-19, and as a result, whatever increase in cases we might see may not result in the same severity of illness or severity of outcome and hospitalization that we saw before. But there's some uncertainty there for sure, and this is why we have to continually, week by week, track those cases in order to understand exactly what the risk is in our community. I would highlight that because of the extensive vaccination coverage of at least 2 doses plus boosters in many of our older individuals in our community, that the case numbers mean a different thing now than they did 2 years ago or 18 months ago or even a year ago. The case count that we can tolerate now is higher because less of those folks will end up in hospital. All that being said, getting COVID is still something that we want to avoid, and that's why we continue to recommend making sure your booster dose has been administered, making sure that you continue to mask, and of course, if you're sick, stay home so that you can protect others as well. Thanks, Jane. Back to you, Dan.
Well, thank you very much, Dr. Summers. Next question is from Jennifer Beeman at the London Free Press. Dr. Summers, Southwestern Public Health, I'm thinking, announced today it's expecting a shipment of Novavax. Are we expecting the same here? How will it be administered by the health unit? And do you imagine the new shot will help reach vaccine holdouts who have been skeptical of mRNA vaccines?
Thanks so much for that question, Jen. Yes, the Novavax vaccine is gradually arriving in Canada and Ontario, and we will be receiving a shipment over the next little while. We will be administering that vaccine through the process of developing a wait list. So in the next little while, we'll be communicating out for individuals who would like to receive Novavax. We'll be asking them to call in to get their name on a wait list, and then we will be rolling out a series of clinics to meet people who've been on the wait list. We did the same thing for the Johnson & Johnson vaccine, which was administered in small numbers in our region to people who did not want to receive either Moderna or Pfizer. In terms of reaching vaccine holdouts, a small number, I think. We did see a small number of individuals who did not want to receive an mRNA vaccine who decided to receive the Johnson & Johnson vaccine. We may see a small number who will also want to receive, rather than the mRNA vaccines, the Novavax vaccine. So we'll keep an eye on that. I don't anticipate that those numbers will be exceptionally high, but there will be a few. And any of these COVID vaccines is certainly better than none.
Thank you, Dr. Summers. We've got a follow-up from Jennifer Beeman, and it relates to the announcement that we made just before the virtual media briefing this afternoon. Dr. Summers, with the Mount Bridges Clinic down to 3 days a week starting next Monday, will you be adding more mobile clinics with the freed up clinic staff?
Thanks for that question, Jen. Yes, we will. As we did last summer into the fall, we will be pivoting our resources to increase the number of mobile clinics that we can offer. Over the month of March that remains, we'll have 19 clinics, 5 over the course of spring break and 14 thereafter. Plans are underway in April to have mobile clinics in schools ongoing, community centers, as well as local malls. So we will continue to be in the community trying to deliver vaccine where people are, of course, with a focus on communities and neighborhoods where vaccine uptake may not have been as high as other neighborhoods in our community.
Let's go to our next question. It comes to us from Sophia Rodriguez at CBC London. And Dr. Summers, this one is for you. Sophia asks, Dr. Summers, we understand you'll be speaking with the 2 English school boards on how to proceed with pandemic protocols. What will you advise them when it comes to masking and social distancing?
Hi, Sophia. Thanks for that question. Our teams have been in constant communication with all of the school boards in our region, and our advice in light of the provincial guidance will be similar to what I'm saying here today. Our school boards, we hope, will be able to continue to encourage masking amongst students of all ages and staff. The impact of that masking is critical to limit transmission in those settings. We will advise them to continue to recommend masking. I do not anticipate mandatory masking policies. However, we'll continue to work with the school boards to understand what is possible there, and again, support them and their decision makers in those critical decisions. They, I will note, get most of their guidance, as you know, from the Ministry of Education directly.
Thank you very much, Dr. Summers. Okay, we've got another question from Sophia Rodriguez. This one, Deputy Acting Mayor Morgan, is for you. Acting Mayor Morgan, following provincial guidelines, the city is dropping mask mandates at facilities on March 21st. How do you feel about that? Are you concerned about it?
Yeah, thank you for the question, Sophia. Yes, the province has made decisions which do change the mask mandates at facilities, some of which the city controls and operates. First thing I'll say is I'll emphasize that those are dropping of the mandates. As Dr. Summers has clearly said, individuals can still be encouraged to wear masks. We can make individual choices on that decision. I personally will still continue to wear a mask in indoor settings for a little while, and will obviously assess that situation moving forward and listen to the guidance of the local medical officer of health, which you've heard given today, which is encouraging individuals in our city to continue to make those decisions. So although mandates may be dropped, individual choice is still an opportunity. So irrespective of how I personally feel about it, obviously the city will still continue to support the health unit in pushing out those messages to the public on their recommendations for what should and should be done to protect yourself in this public health, from a public health perspective.
Thank you very much, Mr. Acting Mayor. Another question from Jennifer Beeman at the Free Press for Dr. Summers. Jennifer asked, does the health unit have any estimates on vaccination coverage among London's homeless population? How effective have outreach efforts for primary series and boosters been locally?
Thanks for that question, Jen. Yeah, great question. We don't have great coverage estimates for the vaccine coverage in the homeless population. Challenging to get both a numerator and denominator in those instances. And so it's a challenging number for us to get. I will say that there's been substantial efforts to reach individuals who are homeless in our community. We've had multiple mobile clinics for both primary and booster series out in our shelter systems. Our main focus actually for our mobile campaign for the booster dose, the first place we went was to the shelters. And we did get a fairly good uptake. I don't have those numbers before me, but we got fairly good uptake generally speaking, but it's hard to know the proportion because it was a bit challenging for us to get that denominator. I'd also note that we have other primary care partners like the London Intercommunity Health Centre that has been a critical partner in helping to deliver vaccination to the homeless community within the City of London. And between primary care efforts, mobile efforts from the health unit, as well as supports through paramedic services as well, I think there has been substantial effort to try and increase booster dose coverage and primary dose coverage. I will note, as we provide more mobile clinics, our objective through the spring and into the summer, let alone into the fall of next year, we'll be continuing to go back to places where we know we need to provide increased access to vaccine, and that's going to include places like shelters. So we'll continue to push that effort.
Thank you very much. We've got another question here. This is from Andrew Graham at Global News Radio 980 CFPL. This one is for you as well, Dr. Summers. Can you explain what power local school boards have to keep mask mandates past the 21st of March? Also, what power do local childcare providers have to extend mask mandates?
Thanks for that question, Andrew. The school board may be best positioned to comment on their authority or how they understand their authority around mask mandates. My understanding is that they do receive substantial direction from the Ministry of Education, and a substantial amount of their policy is dictated through the Ministry of Education, but I would defer to them for a very clear answer on that. In terms of local childcare providers, they will likely have more flexibility with regards to, as a organization, requiring masking should they choose to. I mentioned earlier during my comments that we'll continue to recommend to organizations to encourage, or even in some instances require, masking for their employees and patrons. As an employer, the Middlesex-London Health Unit will continue to require masking for our employees when they are less than 2 meters in an indoor environment with other people. So we'll continue to have a masking policy as an employer in place as the Middlesex-London Health Unit for the remainder of March and April, and we'll reassess. Same as the guidance that we provide to the community, I'll continue to reassess the guidance we provide to our staff and as an employer, as well as to other organizations in the community.
Thank you, Dr. Summers. Next question is also from Andrew Graham, but this one is for the Acting Mayor. Acting Mayor Morgan, are city-run childcare centres considering extending mask mandates past the 21st of March?
Yeah, thank you, Andrew. So your question, when I saw it in the queue, threw me for a bit of a loop, and I said I didn't know the answer to it because I couldn't figure out what city-run childcare centers you'd be referring to, and that's because the city doesn't actually directly run childcare centers, but does fund them through partner organizations. And as you heard Dr. Summers answer, it would be those organizations that would follow the local guidance of the health unit and make their decisions on whether or not they would continue to extend mask mandates in those facilities. As an organization that flows funding to childcare centers, that certainly wouldn't be something that the city would be layering on to that particular funding flow, as that's done through provincial programs.
All right. Thank you very much, Mr. Acting Mayor. Let's move on to the next question, shall we? It comes to us from Matthew Trevithick at Global News Radio 980 CFPL. And this is a question again for the Acting Mayor. Does the city intend to continue with its own masking mandate once the province's expires later this month? The city had its own mask bylaw at one point. Will that return?
Yes, thank you, Matthew. So I will just remind you that bylaws are passed by council as a whole, so I could certainly give you my own perspective on this, but these decisions are made by the entire council. What I will say is when we originally passed the mask bylaw, that was done in consultation and with the support and guidance of the medical officer of health. I don't anticipate council would move forward with any sort of new masking bylaw without a direct ask of the medical officer of health at the local health unit on this. And I think you've heard Dr. Summers' approach to this so far. And as was mentioned, as the situation changes, guidance and recommendations can change. And we certainly stand ready to work with our local medical officer of health and health professionals to follow their guidance and make the decisions that the city can make to be supportive of the actions that they're taking. So our original bylaw was passed in support of actions that the health unit was taking, and I anticipate from my own perspective that we would follow that pattern of behavior in the future. So again, with the caveat that these decisions are made by all of council, not one member of council.
Thank you very much, Mr. Acting Mayor. There's a follow-up question for you from Matthew Trevithick. Mr. Acting Mayor, is the city planning to continue enforcing its vaccination policies for city staff and for members of city council?
Yes, so these are two different vaccination policies, so I'll comment on both. First, there's an administrative vaccination policy that the city manager has put in place under her management of the health and safety provisions of the municipality. That vaccination policy and mandate still exists. It has not been suspended, and my expectation is that that would not change until at least April. Those discussions are being assessed right now with the city manager, and that will be done, as was the development of the policy, in consultation with the local medical officer of health and the local health unit. So that is the current situation on that. It is still in effect and being enforced. As for the vaccination policy that applies to members of council, as you recall, we passed our policy to mirror the staff policy to ensure that the expectations that we put on our employees, we are willing to put on ourselves. And so I would anticipate that council will want to move in conjunction with the changes in the administration policy. I will say that needs to be a decision of council. The earliest time that council could even consider such a decision would be at the Corporate Services Committee on March 28th, which does not report into council until April 12th. So even if there was a decision to move forward, you would see our vaccination policy for members of council stay in place until at least that decision point. So I hope that answers your question. In short, yes, they are both still in force and effect.
Thank you very much, Mr. Acting Mayor. Final question in the queue this afternoon, and it goes to Dr. Summers. And it's a question from Jennifer Beeman at the London Free Press. Dr. Summers, should people be thinking about waning vaccination immunity this spring, summer, and into the fall? How big of a wild card is this looking ahead to late 2022? Is the health unit keeping resources on hand in case it needs to ramp up its vaccination campaign again?
Great question, Jen. Yes, I do anticipate that we will need to vaccinate people again. Waning immunity has certainly been seen from this vaccine, as it is seen in many vaccines. And it doesn't mean it's not working. It means that we have to boost you. And so I do anticipate that as we get 6 months out from the third dose campaign, that discussions around boosters and additional vaccinations will likely increase. I know that the National Advisory Committee on Immunization is monitoring this closely. This is a global question in so many ways. And certainly as we go through the spring into the summer, we anticipate COVID transmission to drop because of the increasing outdoor time that people will spend. But as we head into the fall, we head back into respiratory season, and we're going to have to look at additional booster doses. As a health unit, operationally, we are planning to maintain as many resources as we can reasonably maintain in order to not only continue the mobile activities that we're talking about, but also ramp up clinical operations to deliver vaccine should the time and should the need arise. It is going to be an ongoing balancing act as we try to anticipate the unknown. But I do think additional booster doses will be necessary at some point through 2022, likely sometime in the late summer or early fall.
Thank you very much, Dr. Summers, for that response. That does bring us to the end of our questions for this afternoon. We are grateful for the questions that come from the media, and we are also grateful for the participation, insights, and information provided by Dr. Alex Summers, by Middlesex County Warden Alison Warwick, and by Acting Mayor Josh Morgan. Thank you all for your time as always. That takes care of it for this afternoon. We will be back with our next virtual media briefing on Monday afternoon. That's March the 14th at 2 p.m. We hope you'll join us then. So between now and next Monday, have a great rest of your Thursday afternoon. Have a great Friday and a wonderful weekend. And so long for now.